Hello and welcome to this short video on contralateral C7 nerve transfer, often called CC7. This procedure is used to help people who've had a stroke and are dealing with arm stiffness, or what doctors call spasticity. By the end of this video, you'll have a basic understanding of how CC7 works, what the surgery involves, and how it may help in recovery. After a stroke, some patients find that one side of their body becomes very stiff or tight. This stiffness can make it difficult to move their arm or hand. The medical term for this tightness is spasticity. Traditional therapy can help, but sometimes the spasticity is so severe that more advanced options need to be explored. Contralateral C7 nerve transfer is a surgical technique. It takes advantage of the fact that our nervous system can adapt. Here's the basic idea. Surgeons carefully take the C7 nerve root, one of the primary nerves in the healthy side of your neck, and transfer it across to the side affected by the stroke. By doing this, they aim to direct some of the healthy side's nerve signals to the muscles on the weak side. Over time, this can help reduce that stubborn stiffness and possibly improve movement. During the operation, you'll be under general anesthesia, meaning you'll be fully asleep and won't feel pain. The surgical team will make an incision in the side of your neck where the healthy C7 nerve root is. They'll gently separate this nerve root and route it across your neck to the side weakened by the stroke. If it's too short to reach, a nerve graft may be used to bridge the gap. The hope is that after the surgery, with proper rehabilitation, the new nerve connection will start sending signals from the healthy side of your brain to the previously stiff or weak muscles. Recovery from CC7 surgery is not immediate. After the operation, the nerves need time, often many months, to regrow and form stable connections. During this period, you'll likely work closely with physiotherapists and occupational therapists. They'll guide you through exercises to help retrain your muscles and maximize your new nerve pathways. You may also experience some temporary weakness or tingling in your donor arm, but for most people, this improves over a few weeks or months. The potential benefits include reduced spasticity and better control of the affected arm. For some people, even a small improvement in arm movement can mean a significant boost in everyday tasks like eating, dressing, or riding. As with any surgery, there are risks. These include infection, bleeding, donor arm weakness, and the possibility that the procedure may not yield the improvements you'd hoped for. Always talk openly with your medical team to weigh the pros and cons for your individual situation. Contralateral C7 nerve transfer is an exciting option that offers hope for people struggling with arm stiffness after a stroke. It combines cutting-edge surgical technique with the body's natural ability to adapt and heal. If you or a loved one are considering this procedure, be sure to discuss any questions with your doctor, therapist, or surgeon. Thank you for watching, and I hope this video has given you a clearer picture of what CC7 nerve transfer is all about. Take care, and I wish you the very best on your journey to improved function and well-being.